Trauma-Informed Universal Precautions. Trauma-Informed Universal Precautions. Trauma-Informed Universal Precautions. Remember these 5 so we can all thrive. Use therapeutic communication. No room for judgments on anyone. Create a healing environment. Consider and address pervasive crisis and practice self-care. Don't forget your self-care.
Yeah, baby. Here we go.
Davis, come on, time to go to group. We're gonna be late again.
Okay.
Come on, guys.
I'll be there in a minute.
Come on, Davis. I said now. Let's go. We can't sit here all day.
I'm in the middle of a game. She has no respect for me. I mean, who treats anybody like that? Especially an adult. She treats me like a child.
Oh, come on. I said now. Come on, you guys. Let's go.
Ugh, he's so manic. I just wish he would come to group. I just want him to get better. I'm tired of begging the patients to do things. I'm so tired and I just want to get through this day.
No vale la pena.
I didn't understand you. Could you repeat that?
I said it's not worth fighting over.
Well, we need to go to group. Come on.
Oh, goodness, Derek. Did you see that?
Yeah, I really want to help, but where do we start? How can we help them?
This is why we need trauma-informed care universal precautions.
Oh, you mean like when doctors are required to wear gloves when taking blood, masks and gowns in surgery rooms, stuff like that?
Exactly like that. Except, in this case, we're trying to avoid the triggers associated with trauma and to avoid the spread of trauma.
Oh, I see. That makes sense. It is really very much needed for both its clients and the staff as well. Can you tell me a little bit more about these universal precautions?
Yes, of course. So there are 5 universal precautions that can help prevent situations like this from happening. The first one is to consider and address pervasive crises. This means we're all going through difficult times in our lives, and we need to acknowledge this. We should assume everyone has gone through some kind of trauma in their life and keep this in mind when interacting with each other.
You're right. When Lynn started yelling at John, she really wasn't considering past traumatic experiences John may have had that involved loud yelling.
Yes, that's exactly what I mean. And Lynn has probably gone through her own traumas as well, but as staff, we need to be responsible for our own reactions.
Yeah, that's actually super important to point out. Staff are also struggling with their own traumas.
Exactly. So let's move on to the second one. The second universal precaution is to use therapeutic communication. This means that we approach the client in a caring and non-judgmental way so that they feel safe and understood. We must always look at how we approach the client. We should do it in a respectful way and be aware of our tone of voice, eye contact, body language, because they may be making the client feel unsafe. We also want to listen compassionately to the client and allow for them to have a voice and choice over their life.
Yeah, I didn't really see Lynn do that when she aggressively interrupted their game and called Gerald by his last name. She almost sounded like a drill sergeant.
I completely agree on that one. So let's move on to the third universal precaution. This is no room for judgments, meaning we should respect culture, gender, race, ethnicity, and sexual orientation. We should also never judge a client for their behavior or have their mental health diagnosis overshadow the person that they are.
I totally agree. It kind of offended me when Lynn said, "He's so manic," to describe the way Gerald was acting. I don't really like it when staff generalize people by their symptoms and disorders. He was just excited about the outcome of the game, but she didn't really take time to read the situation, so it came across as judgmental.
Exactly. I completely agree with that one. We shouldn't be too quick to judge all behaviors as part of their mental health diagnosis. This leads me to the fourth universal precaution, which is to create a healing environment. We should create an environment where a client can flourish. Now, Imagine clients who are struggling and come to a place where we are supposed to be helping them. Yet the environment is doing the complete opposite.
Yeah, the whole interaction between staff and clients felt off there. It didn't feel like a supportive place at all. It felt combative. It's got to be hard to recover in an environment like that.
That's exactly what I was thinking. Lastly, we must all practice self-care. In order to do this challenging work, we must take care of ourselves first. We also must be aware of our own triggers and traumas and know how they might be affecting our work. Also, it helps to take a break before you reach that breaking point. And don't be afraid to reach out for support from your colleagues.
Yeah, Lynn didn't take lunch, if you noticed. I wonder if that had anything to do with her irritable mood.
Maybe it did. This scenario, it gave us a number of examples of what not to do when supporting people in a trauma-informed way. Let's see if they can fix this using the Trauma-Informed Care Universal Precautions.
All right, let's see what I got.
Hey, John and Michelle, looks like you're having fun.
Yeah.
Only by a little bit.
Oh, I'm really sorry to spoil the fun, but are you guys at a point where maybe you could stop and pick up the game later on when we have some free time? Because group's coming up in a few minutes.
Really don't want to go to group. But I guess we can pick up the game later.
Yeah, that sounds good.
All right.
Here, come on, maybe you guys can even teach me later. I don't know how to play anything.
So Derek, what do you think about that one?
I really liked this time how she approached them and acknowledged the fun they were having.
I couldn't agree more. She really validated their experience.
Yeah. Let's take a look at another scenario now. I wonder if they'll follow the universal precautions this time.
Oh, God, I didn't get my coffee today. Thinking about all the stuff on my plate at home, my kids' homeschooling, I have an elderly parent. I don't know if I can face this day.
I'm so worried about my mom. I can't even call her when I want to. I've been up all night worrying. I don't know what to do anymore.
Oh, gosh.
Lynn, can I use your phone? I need to check on my mom.
I just got in the door, Michelle, and you're already asking me for stuff? Really, the world doesn't revolve around you.
Nobody cares about me here.
I'll be back.
Giovanna and Derek, we really need your help. The atmosphere needs to change around here.
We got you, Michelle. Derek, don't we?
We do.
I realize these are challenging times and we're all on edge. We need to be aware of what we're bringing into our work environment and how it may affect our clients.
Yeah, it's understandable for Lynn to be stressed with what she's got going on in her life, but that doesn't give her the right to treat Michelle like that. She was just plain rude.
Yeah. I felt like Lynn before, and it's been hard. But what's worked for me is working on my own self-awareness and checking in to see how I'm feeling and what I need before I start my workday.
Chocolate, maybe?
Chocolate always helps make any problem a bit better. That actually sounds yummy. But I was thinking we need a little more than chocolate for this situation. Like have time set aside for pre-work rituals, a favorite music playlist on the ride into work, maybe a couple of minutes of a breathing exercise in your car right before you walk into the office, a coffee run to your favorite coffee place. There are many things you can do for yourself to get you in the right mind frame to have meaningful interactions with your clients and your colleagues.
Works for me. Let's see what happens this time when we take time to consider the Trauma-Informed Care Universal Precautions.
I've got a lot on my plate. I have to acknowledge that. But I gotta take care of myself before I come in here in the morning, so self-care is really important. Hey, Michelle, how are you doing today?
I'm okay. I'm just very worried about my mom. She's been really sick and I just want to check on her. You think I could use your phone to make a phone call?
Okay, well, I just got in the door. It's like, let me see, where's my phone? Oh, 9:10 now. Can you give me like just a few minutes to put my stuff down? Maybe come back to my office in about 5 minutes, so like 9:15-ish, and I'll help you call your mom.
Thank you so much. I appreciate it.
Thank you for being patient.
Of course.
I like this outcome much better than the last.
Me too. I like how, even though she has a lot of stressors going on in her life, she took a few moments to acknowledge them and sit down with some breathing exercises before she stepped foot in the door.
Yes, definitely. Well done, Lynn. Okay, I think we have time for one more.
Finally take my lunch. Hi, this is Lynn.
Hey Lynn, I need you to work on this treatment plan as soon as possible.
I was just about to take my lunch. Okay, I'll just take lunch later. Bye. Whew. Could finally have my lunch.
Can someone set up the television so we can play?
Oh my God, I'm so hungry and now I can't get my lunch again. I told you about this screaming. It's completely disrespectful. If you don't stop yelling about the game, you're not going to be playing any games whatsoever.
Why does she treat me like a child?
I really need to talk to the psychiatrist about him. He's acting so psychotic right now. There goes my lunch. I guess I'll just pick up fast food on the way home again. I really could use a cigarette.
Okay, wow. Her reaction reminds me of that term when you're both hungry and angry.
You mean hangry? She definitely looked hangry.
Yeah, we've all been there. Sometimes things go awry at just the wrong time.
That's true. We have to respond to crises, but if we don't take time to plan ahead for our own self-care needs, it will eventually start to impact the quality of our work and our interactions.
It's definitely hard to help people recover when we ourselves aren't taking good care of our own needs.
Yeah. I like singing in my car on the way to work. It always puts me in a good mood.
Singing can definitely boost your mood. All right, let's check in on everyone one last time.
Hey, yeah. Oh, I'm just about to start my lunch break. I haven't eaten lunch for the last couple of days. Do you mind if I take my lunch and then I'd be happy to help you at 1:30? Hey John, can you back up a little bit? Thanks, bud. I want to thank you for being so patient. I'm really sorry. I know you've been waiting all morning to use that TV. I just started my lunch. I can call Sarah and Amy and see if one of them could hook up the TV for you. If they can't, can you give me maybe 15, 20 more minutes so I can eat my lunch and I'll be happy to help you.
Why don't we go through these one more time?
Okay. So again, we have 5 trauma-informed care universal precautions, which will help us provide the best quality of care to our clients and make life easier when dealing with colleagues. Number 1, consider and address pervasive crises. Number 2, use therapeutic communication. Number 3, no room for judgments. And number 4, create a healing environment. Derek, do you know what the last one is?
Practice self-care?
Correct!
You know, staff may not think that trauma and how we interact with clients is such a big deal, but sometimes when you listen to people who've experienced trauma, you can learn a lot from their stories, and that is super important to remember.
Yeah. Speaking of which, let's hear from the staff and clients one last time.
You know, there's more to me than just my mental health conditions. I wish staff would listen to me and work with me for my needs and wants and wishes for my life, instead of just telling me what to do and how to act.
Look, I've been through a lot in my life. I just wish they wouldn't shame me for acting out the way I do. I just want to feel safe and they don't let me feel safe here. I feel like I'm being punished for having a diagnosis and not being respected.
I mean, this should be a collaboration for me to get better, and the staff should respect my input. Also, I feel like I'm being punished for being sick. And, you know, when they yell at me, I want to yell back.
You know, I get it. Everybody wants to feel safe, and we all need to collaborate more with the people that we serve in order for them to get better and to keep us safe. If the culture is going to change around here, I need to do my part, and we need to hold each other accountable.
Trauma-informed universal precautions. Remember these 5 so we can all thrive. Use therapeutic communication. No room for judgments on anyone. Create a healing environment. Consider and address pervasive crisis and practice self-care. Don't forget your self-care. Trauma-informed universal precautions. Trauma-informed